Although the standard definition of constipation is fewer than 3 bowel movements in a week, for the most part, patients feel if they don't go every day, they feel constipated. And if they have very hard stool and they have to push hard, or they don't feel like they fully empty their bowels, they often like to use the term constipation as well. So we're using it in that broader perspective. Why am I constipated so often? Well, not me, but it's the topic of the video. Hey everybody, welcome back to Dr. Ashley, your go-to channel for everyday holistic health tips for the times we live in, also known as eco-medicine. Consider hitting the subscribe button to stay updated on the latest health tips. There can be so many reasons for chronic constipation. Some are more concerning, so make sure that you talk to your doctor to rule out anything that is more concerning. But here are some of the reasons for the more common types, and in this case, it can be more of a mild problem, but still really bothersome. Sometimes even for years, people complain that they never really can just go normally every day. More sudden types of constipation can be from a number of other issues. So we're really talking about people just who have on and off issues long-standing with constipation. Although the standard definition of constipation is fewer than 3 bowel movements in a week, for the most part, patients feel if they don't go every day, they feel constipated. And if they have very hard stool and they have to push hard, or they don't feel like they fully empty their bowels, they often like to use the term constipation as well. So we're using it in that broader perspective. Okay, some reasons for constipation. Number 1, not enough fiber. Most Americans eat under the recommended amount of fiber, which is 25 to 30 grams. One very under-eaten source of fiber simply just comes from quality vegetables. Number 2, many people do not drink enough water. The recommended amount, and this is for adults without kidney, liver, heart, or other diseases, and who are not on a water-restricted diet, generally it's somewhere between 6 and 10 full cups of water a day. It's actually not insignificant, and most people don't meet that amount, and it's partly dependent on weight. Number 3, food sensitivities and allergies can also cause this, but sometimes the opposite issue can happen as well, which is more loose stool or diarrhea. Many people with more serious reactions to gluten, for example, can develop constipation. Number 4, travel to different time zones and jet lag can significantly confuse the circadian rhythms and lead to constipation for a number of days. Number 5, stress can worsen constipation since there is a second brain in the gut, and the gut feels stress profoundly, not just the brain. Number 6, one commonly not often thought of reason for constipation is structural. Sometimes musculoskeletal imbalances can affect constipation, and these people may need to sit in a different position like squatting. Number 7, deep emotional triggers. Some people have even chronic constipation from childhood-related issues or stress. This generally needs to be worked on closely with a licensed psychotherapist. Number 8, gut infections. Parasites in certain bacteria or imbalance of healthy bacteria can lead to a lower number of probiotics, and this sometimes can result in constipation. Number 9, low functioning thyroid and other hormonal imbalances. Number 10, certain neurological disorders can lead to issues with nerves that cause the muscles in the colon to basically not work properly. Number 11, there are very concerning reasons like cancers and bowel obstructions. This is why it's really good to have constipation checked out with your doctor. Number 12, people who do not exercise regularly may also have more issues with constipation. The body likes to move. Number 13, medications. Certain pharmaceuticals can cause constipation. You can look online and find an extensive list if you are taking any pharmaceuticals. And number 14, low magnesium. Yes, low magnesium levels can affect constipation. There are other reasons, but these are 14 I can think of right now. This is Dr. Ashley. Thank you for joining me for another episode. I hope these tips have been informative, and knowing reasons why you might be constipated will help you figure out what you need to do to improve your health and lifestyle and go more regularly. And don't forget to subscribe for future updates on how you can live a healthier life.